Hi, my name's Ty. I work at MD Beauty Lab with Portland Plastic Surgery Group, and I am a aesthetic nurse here. When there's too much projection, I think a lot of times it could be the type of filler somebody is using. Um, there's so many different types of fillers out there in the world, and some attract a lot of water, some attract less water, some have larger molecules, some have smaller, some are firmer, and some are a lot softer, a lot more stretchy. And I think all of that plays into it. So when you see a lot of projection, um, I think that's when somebody's using a firmer, bigger molecule and one that attracts a lot of water. And, some people want that look, but I think most people um, would like to not have that projection, especially from from the side where your lips are sticking out way further than, let's say, your nose and your chin. Um, whereas, like facial balancing, that's what we want to do and help people with. Yeah. So I mean, I would come in, sit down, and say, usually it says on the appointment, that they're there for lip filler. So I'm like, are you in here for lip filler? And then, yeah, they're, a lot of times they're like, yeah, my lips are thin or my lips look like they're always dry and wrinkly. Um, and then I assess their lips and I kind of let them know just to make sure. Cause sometimes, with lip filler, that's all people really want. And that's what their desires are. But, the bigger picture, if you're doing a full face assessment, they might need a little bit more other places to balance everything out. So it's if they have, a very small chin or a very uh their face isn't, very wide or things are not very well, you want everything to be balanced, right? So and then they have the thin lips and then you make your lips really big. So you have a small chin, then that's gonna really stand out. You wanna make sure you're assessing the whole face, even if somebody's just in for lips, and just point it out to them, not saying that, like, "I'm not gonna do it unless you do this," but just let them know, like, "This is my suggestion. We need to do A, B, and C, and then your lips are gonna look it's gonna make everything look, well-rounded." Um, and some people, take that and they're like, "Okay, yeah, let's run with that." And some people are like, "I just wanna do the lips," and that's fine too. I'll say, "Let's, start with the lips and then see how you feel, because then you might think differently when we're all done." Typically, if somebody was, like, very adamant about doing a consult and a treatment in one at once, I just try to add a little bit more time, to their appointment. 'Cause I wanna take my time with the consult. I think that's a huge part of, um, the care that we give. We wanna know exactly what somebody wants and give them those desired results as best we can, so taking our time with the consult is, like, key. It's nice when they can come in prior and do a consult and then really, like, go home, think about things, and then come back, but consult and treat, that's normal, and we do that all the time. Yeah, you just look up MD Beauty Lab. Our website will pop up. You can click on that. There should be our phone number listed. Give us a call. You can also, there is a section to fill out, like a contact us. And then when you fill that out, somebody from our office will receive that and then give you a call. My Instagram handle is Thai Aesthetics PDX.